Hey, welcome to the Default Profitable Podcast. And while most of our episodes are about how to start, run, and grow a small business, today we're going to talk about an issue that affects pretty much every small business owner: health insurance, healthcare, and the spiraling and nonsensical system under which we provide both. So I'd like to welcome my guest, Ben Connor, CEO of Connor Insurance, who recently made a documentary. Ben, welcome to the show.
Matt, thanks for having me.
No problem. So why don't we start with you telling us a little bit about yourself, why you made the documentary, and then the documentary.
Yeah, so I'm the CEO of Connor Insurance. We're a third-generation insurance agency based in Indianapolis. I believe you have interviewed my cousin, Zach,
Yep.
So we don't need to go into that story.
No.
So I joined the firm in 2006, and by 2009, I quickly diverted into the employee benefits and healthcare space. And it's really been a good fit for me for a lot of reasons. But so I've just spent my career in the health insurance and healthcare side of things. And people probably are wondering, why does he keep saying health insurance and then healthcare? But the reality is, when we talk about health insurance and how expensive it is, we have to talk about healthcare and how expensive that is.
Yes.
They're intertwined. So I've been doing this been in the business now for, I guess, 18 years. And really over the last probably 10, have gotten really into the idea of supply chain management in relation to healthcare, and how employers have a duty to do this on behalf of their employees as they deliver health insurance, because health insurance is really expensive. In fact, the reality is health insurance is so expensive that we expect that our healthcare deliverable in the United States is the best in the world because it's the most expensive in the world. But the reality is it's not. Our costs keep going up, but our value for that cost keeps diminishing. So that's why we did this documentary project. And the idea of the documentary is to really shed light on the business of healthcare. That's why it's called "It's Not Personal, It's Just Healthcare," kind of off the tagline. It's not personal, it's just business.
Right.
Because there is a business side to healthcare that needs to be told, and employers certainly need to understand it, since employers are covering and paying for insurance for half of the American public. And employees need to know that because they're spending money out of their paychecks for said benefits that employers are purchasing on their behalf. And for there to be change, it really needs to come from employers. And employers will only do this with support from their employees.
So if you were going to give us a quick introduction to the point of kind of, hey, here's the message I'm trying to deliver to people. Like you kind of gave us the symptoms of it, but if you were to skip to the end and say, okay, here's the final page, here's the conclusion I want you to draw from all this, what would that sound like?
That there's hope, that supply chain in healthcare does exist, and employers can participate in it, and so can employees. But you have to pursue it, and you have to align yourself with partners that can help you do that, which I think that's the only message that gives us any sort of hope, is that you can actually solve the issue.
You can't solve it. Let's step back. You can start to manage it. So we were talking beforehand. My daughter had a kidney transplant, and part of the kidney transplant is she needs to immediately start taking anti-rejection drugs, or else her body will say, hey, not my kidney, I need to get rid of this. Well, the insurance company approved the kidney transplant, and approved dialysis, approved everything up to the operation, but then rejected the $20,000 anti-rejection medicine that she was required to take within 24 hours of the operation. And it's not a cost savings thing. It's a standard policy thing because of the size of the prescription. They just automatically reject the bill. For me, that was the thing that highlighted, like, there's such a disconnect between health insurance and health care and health outcomes.
The circumstance that you just explained, it makes no logical sense. it's known that it has to be taken within 24 hours of when the surgery was completed, and so that's something that a sensible system can work itself out and figure out a way to pay for it and make it work. You know, so I think that, obviously that was a very specific instance, but in general, there's a lot of issues within healthcare that's similar to that, or even that when employers take ownership of and rebuild a supply chain that works sensibly, then we can start to solve those issues. But to your point, I think it takes courage, because the system, it's been said by multiple people, Marshall Allen, David Contorno, which they're in our industry and who have been very influential folks. They will say themselves, and it's been said largely from them, the healthcare system is not broken. It was intentionally built by the folks that are doing really well with the system being the way that it is. The problem is that for the consumer, it's an issue. We have two paths out of this. One, the employers take ownership and solve the issue. And if not, if they don't do that, then the government will step in and they will take control of it. Now, will they solve the issue? I haven't seen government solve very many issues very well.
Well, they're pretty good at spending.
They're good at that.
Efficiency, not so much.
Yeah. So, in Medicare, and we know how, well, we don't need to go into the status of government programs and those sorts of things. We know that we're in a major deficit, and the government getting involved in a part of our economy that's 20% of the economy won't bode well for those deficits or something being improved.
Now, let me ask you a question. I'm being self-employed for the past 20 plus years. At one point, I was actively using an HSA, which incented me to save money in a way that traditional insurance doesn't. How much of a marketplace is there for HSAs and rewarding individuals for cutting healthcare costs?
Well, it's interesting about that. So HSAs have been largely curated and have been promoted for really since I started in the industry. So it's probably been 18, 20 years or so, and under the idea of consumerism. And for folks with disposable incomes, I think that HSAs have a strong place. There's tax deductions. There's the ability to really work on negotiations and that kind of thing. I think for the general American public, participation in HSAs have largely been an issue that has caused lots of folks that, again, don't have disposable income, has caused lots of folks to avoid treatment or have caused folks to forego medications that they need. So there is actually a push back to a copay system, or what we like to promote, and we will there's several employers that we work with that have done, is as they manage the supply chain, they say, hey, look, if you go to this top quality physician, or have this surgery done by a top quality surgeon, then we will waive your cost share in entirety. It's free. But because we know that if you're going to a quality physician or surgeon, that you're going to get more appropriate treatment, and you're going to get more effective treatment where you're not going to have readmissions, infections. Your risk for those sorts of things go down, which also lowers the cost of care.
So what's your role? Because you guys are insurance brokerage, right? So you do that. But then how do you get involved in the supply chain side of it? So why don't you explain that a little bit?
Yeah, so as we work with employers, and employers can either buy their health insurance program from an insurance company and really offload that risk to an insurance company, and they can pay a monthly fixed amount for that risk. We call that fully insured. And in Indiana, that can be done through like an Anthem, United Healthcare, IU Health, and there's some other organizations across the state. But there are other employers, and it's usually by size. There's other employers that can more or less custom build their program through a self-funded built program. They still have insurance that protects large risks and can create some sustainability in that way. But when you're a self-funded employer, you have the opportunity to purchase parts of the supply chain that was purchased by Anthem and given to you in their fully insured environment. So you can choose what network to use. You can choose what medical manager you want to use. You can choose what pharmacy benefit manager that you want to use, and the terms of which, you engage with them. And then in that ecosystem, then you can start to see information that allows you to manage cost and care. So I'll give you an example. There was a large healthcare system in the city of Indianapolis, actually, where one of our self-funded employers had a member of their health plan that was diagnosed with cancer, was receiving treatment. That treatment was $28,000 every other week. So 26 weeks, that's over $700,000 for that treatment. So we simply looked at what it cost to acquire that medication and pursued other hospitals, so somewhat of like an auction, to say, as long as they have the right providers that can actually do that, what would you charge to administer this medication and treat this patient? And we had a reputable hospital with quality physicians that would have done that for $7,000 every other week, which is $182,000. So we're talking about $500,000, over $500,000, simply by saying, what's the cost of the medication? Who are quality providers that can administer it? And who wants the piece of business? And in exchange for that, the employee doesn't have to pay anything, because they're taking the recommended path of high quality and really managed cost. We're not saying low cost. We're not asking them to have their cancer treatment administered in a car somewhere, or in an unmarked building. It's at a reputable hospital with quality physicians, and it's really creating a marketplace within healthcare, which doesn't exist.
Well, and so that's my second question. So that's the first example, but how about the pursuit of price transparency for procedures?
It's funny. A lot of healthcare providers will say, well, if there's price transparency, prices will actually go up. Obviously, we all know that that's not true, because it's never existed in any other form in our market, in the American economy. But it's really important. There's been federal legislation around price transparency, which has been really good. In fact, we've had a lot of Hoosiers in our state that have contributed to that cause at the federal level. So we have much to be thankful for in our state for some really, in my opinion, some healthcare heroes that are promoting change. But we've also had a lot of good work done at our state house that has talked about legislating price transparency in healthcare, which, as we know, that doesn't exist. One thing that I think also needs to go with price transparency is really the ability to know the successfulness or the quality of a physician. Unfortunately, we're in a world where we get people's opinions of, hey, the doctor was nice, or my surgery ended up going well. But, largely it's, what doctor do you want? Is it in your network? And we don't know if it's the best doctor, at that facility, or if it's the worst doctor at that facility. It's really difficult to find that information. And I do believe that, the American public needs to know that information more regularly. We have the ability to supply that information, but it's still gated and very difficult to get access to, and very difficult to implement. But I think that's really important to go alongside price transparency.
Well, and that's it's the old, one half of all surgeries have a below average outcome. And I mean, it's just, but you ought to at least know which half.
Right.
Right. So, and then there's the final piece of this, and this is a piece that your nephew's talked about, but the pushing back when billed, and how to respond to bills that you get from medical providers. So it's not exactly supply chain, but can you talk to that a little bit too?
Yeah. There's a wonderful book called Never Pay the First Bill by Marshall Allen. And it really talks about how just in medical billing in general, there is a lot of error. And even the circumstance that you explained with your own personal situation, there are things that happen within the healthcare system that just, 1 + 1 does not equal 2.
Yeah.
And I think we really need to have um, an attitude when it comes to healthcare of how do we stand up for ourselves. I think we know that, but healthcare can be so complicated. It can be scary that when something happens, we kind of want to distance ourselves. Well, that's really complicated. I don't really understand it, so I'm gonna avoid it. I'm gonna stay away from it. And that really needs to be the opposite. We really need to run to that. And again, I think we know that naturally. I think most Americans know that if you have a loved one in a hospital, like you need to be there to advocate for them. If they're going to be there by themselves, like things can happen. Not that the nurses are bad people or anything like that. It's just when anyone's going through something, like we need to advocate that they have the best of anything. We want that for our kids. We want that for anything, for our jobs, whatever it may be, and that applies to healthcare as well. We know it. I think we need to lean into that a little bit more of who we're going to see when we get a bill. Like, do we actually owe it? Is it coded appropriately? Did I receive the services that they're actually billing me for? I think thankfully within the program that we supply to our employees, we have two organizations. One is a medical management organization who looks at services that are been recommended to our team and just reviews it to say, like, is that appropriate treatment? Like, as a defense mechanism of, like, they say you have this, they told you to do that, but medical guidance doesn't say that you're supposed to do that. So that could actually harm you. So we have a relationship like that within our plan. And then we actually have a medical bill review company that reviews our employees' medical claims to make sure that there was no charges that were inappropriate or egregious, which I think is a great ad for our people. It protects their money that they're working hard for. It's making sure that things are appropriate. So, it's just kind of when men start getting charged for pregnancy tests, that's when we all know that we should start looking at our bills.
Yes, because there is no way that happens. So your documentary's out. Where can people actually watch it?
It'll be on demand on our website, where people can go and watch it there. It's about 70 minutes long. Perfect time where you can actually get the full story and kind of understand like where it's headed. Not too short, not too long. It's exactly what it needs to be.
Yeah. And then you mentioned a book. So in the show notes for this show, anybody that's listening, they'll be able to go. There'll be a link to your website. There'll be a link to any other resources you want to include, ways that people can actually interact with this. I think this is such a big thing that affects people. I know, my job, I train small business owners and their sales teams to sell more. But one of the things that I hear is a lot of people won't start a business because they don't know how they're going to get health insurance, which is crazy. But it's such a huge expense. And then you get somebody like my daughter who's got, she's got a third kidney now. Well, she is kind of like screwed for health insurance for the rest of her life, and which restricts the things that she can do based on the system that we're in. And there's some things that we can't avoid, but there's some things that we can manage. And it sounds like you're really kind of taking a look at the things that we can manage.
Yeah. I mean, we can't worry about things that we can't affect because, simply it's just not going to be helpful. But we also need to dream big about what things can we impact. And, I think our economy, the general American public, we're relying on employers, and particularly larger employers. I'll call it larger employers where they have over 50 employees to really get involved and start managing this. Because if there can be effective change in the healthcare system because of these employers, and the reason why they can do it is because they're paying for it, then that can cascade down throughout the system and then can help even small businesses in the future.
Absolutely.
But we're really relying on those large businesses to go after this.
Yeah, that is the key. Well, anything you'd like to close with? That's a quick 20 minutes.
Yeah, that did go really quick. No, I really appreciate you having me, and to be able to share the story of the documentary. I just encourage everyone to go watch it, whether you're in control of a health plan or you're an employee at a company that offers health insurance. I think it's really important to educate ourselves on like really what's the business of healthcare.
Yeah, and it is a business.
It
So
is.
thanks for our listeners. If you want to help the podcast out, hit that subscribe button, hit that review button, share an episode with somebody you know. We'll be back next week with another how to build, grow, and scale a small business. Ben, thanks for being a guest.
Yeah, thanks for having me.
And thanks for taking the time to figure this all out for us. We'll be back next week with our next episode.